women of the world. Welcome to my podcast, Learning to Live for Change, or L2L4C. First episode, Fighting for Fertility. If you didn't catch last week's episode, I would advise you to go back and do a quick recap. In that intro, we talked about learning to live for change, who we are and what we stand for. And it's only 4 minutes and 36 seconds. So I think it would be definitely worth it so that you can be caught up to speed with this week's episode, which is the one I'm going to be speaking about now. And just to give you a quick recap, Learning to Live for Change, we are fighting for women leadership, encouraging leadership across the globe. We're advocating for women in change. So whatever that may be. Over the course of the next couple of weeks, we're going to be focusing on my journey, my battle that I've been going through this past year. And I'm going to be sharing with you why I decided to fight for my fertility. So, but as the podcast continues further on in the future, we will be discussing different things, having different topics. I'll be having guests, that can relate or that can help encourage or motivate women across the world on whatever it is we may be speaking about that particular time. So, welcome. I'm excited for my new podcast. And again, those of you who don't know me, my name is Felicia. I'm the CEO and founder of Learning to Live for Change. So let's get right to it. I'm 42 years old, no kids. And this most recent, this past year, I've been going through a lot, actually. I've been going through a lot of things that is relating to my female body. So I've learned a lot. I've learned so much. And I just decided I wanted to share it with the world, the women of the world, because it's extremely important for us to know our bodies and know who we are. So, because that can bring change, right? So I'm all about change. I'm all about helping to promote change for women and change for the good. So last year is when I started my fertility journey or battle. But I would like to first say that I'm not giving up on having my kid because I'm 42 years old. We always hear, you're reaching a childbearing age or you've passed the childbearing age, and it kind of plants in a female's mind when she gets to be a certain age that she can no longer have kids or it's high risk, etc. Well, I'm not trying to hear any of that. Thankful to God, my mother is 87. She had me when she was 45. Yes, her and my dad had me when they were 45. So again, I'm kid number 7. All the doctors and nurses were like amazed that this 45-year-old woman was having a natural birth and her child was healthy and happy, thankful to God. So, and my mom now is alive and well. So she's my motivator. My mother has inspired me so much to keep going, keep believing in what you want to do and trusting God. And I believe that. So again, I'm going to have my kid. Okay. I'm very confident in that God would give me the desires of my heart. So, a few years ago, I want to say maybe 3 to 4 years ago, I'm almost positive it was about 4 years ago, I started experiencing bad cycles. And so for those of you, I refer to cycles, menstrual cycles and periods. I just use the word cycle, just so you'll know. So my cycles were terrible, okay? Back pain, severe knee pains, excessive blood. I would literally be in a fetus position. Can't move, nauseated, can't work. I mean, it was unbelievable. So I want to first say I'm not a medical doctor. I'm not a nurse. I'm not a medical profession. I did not go to med school. I did not go to nursing school. I have a degree, sociology and communication, but not in the medical field. So everything that I'm telling you, women of the world, I am strictly telling you things based on my experience, what I've gone through in the most recent years, but more importantly, this past year, my fight for fertility. So at the time, I was referred to a doctor from a friend of mine, very good friend of mine. And I was in the middle of transitioning my mom. So I basically went from full-time work to part-time work as her caregiver. And so I didn't have health insurance. So women of the world, please, please, please don't deny yourself the health that you need as far as medical checkups, going to the doctor for basic blood work because you feel you don't have medical insurance. And that's for those who don't have medical insurance. There's so many different resources in cities that can help you. And so I encourage you to do some research, be knowledgeable of the places that your city offers. So for me, I went to a community clinic and it was amazing. It was awesome. They were so helpful. They were understanding. They were willing. It was just amazing. And my doctor was referred by my friend. And she was the best. I was with her for about 7 years. She was my gynecologist. So I would talk to her and explain to her, what I was feeling, the things I was going through with my cycles. So she tried birth control pills. We tried that. It helped a little bit, but it wasn't solving the problem. And again, for me, the problem was severe blood loss. I actually became anemic because I was losing so much blood monthly. Extreme pain, cramps, knee pains. I mean, it was just a lot. Women, we do not have to suffer in silence like this. If you are experiencing any of those things that I said, I encourage you to do some additional research and I encourage you to speak to a medical profession because more than likely you are having an abnormal cycle. It is not normal to have those type of cycles. Okay, so please speak to a medical profession. I would do some research. There are community clinics within every city. They usually base it on your income. So I'm not sure how every one of them work as far as the process, but usually you fill out an application. It asks you questions about your income, your employment. And then from there, your approval usually will be based on that. And you may pay $10, $15, $20 for your clinic visits. I think there's even discounted medication. If they have to write a prescription, there may be a clinic that they can recommend to where they work together with for discounted medication. So there's all kind of ways where you can go and get yourself checked. So for me, I would go and get my yearly exams, so my pap smears. And women, I'm sure, I'm not going to assume, but I'm sure you know what pap smears are, but to not make an assumption, that's when you go and you're getting your examination for cervical cancer. And I know back in the days it was every year, but it looks like they're changing it now depending on your age. It may not be required every year, but just check with your medical profession on that for clarification. Remember, I'm not a medical doctor. I'm not a nurse. I am strictly telling you things based on my knowledge, things that I've learned, which has been so much that I'm deciding to share with the women of the world. So a well woman's exam usually is a pelvic exam. And then they do an exam where I think they clip some tissue, they take it off to the lab, and they're looking for cervical cancer. Okay. So, and then it include a hand breast examination. So usually they will, feel around on the breast, maybe squeeze the breast. And they're looking for lumps, any abnormalities that can possibly be a sign of breast cancer. So those things are included into a Wells woman. And then a physical, they'll do some blood work. I think they do some HIV testing, different STD testing, HPV. So there's so much, I'm telling you, to know and learn and understand about women's health, and what's important and why it's important. So I will encourage that. So now my doctor and I are coming to a determination that, yes, something's going on. You are literally living a life of misery. Okay, so she decided to send me to a diagnostic X-ray facility so that they can do what is called a transvaginal ultrasound. Okay, I'm going to tell you, women, I've learned so much, so many different tests. I have encountered so many tests this year. It is unbelievable. And everything that I go through as far as exams, tests, or any type of anything, blood work, I'm very curious, and I'm definitely very curious about my body. I do additional research. So I'll be going to study to see what it is that this doctor is ordering for me to take, or what type of labs. I mean, I'm nosy, especially when it comes to my body. And I encourage all of you women to be the same. Okay. So transvaginal ultrasound is an ultrasound that's done vaginally. Okay. It's some type of waves that they're able to look at your pelvic organs. So those organs are female reproductive system. That consists of your cervix, fallopian tubes. They can see your ovaries, your uterus, your vagina, your bladder. The transvaginal ultrasound just allows you to see your whole uterus. And it can see various things, a variety of things. And it can allow your doctor to be able to determine what it is that's going on or what may be going on with you. So, this was outsourced from the clinic. And again, I was able to go pay out of pocket because, again, transitioning my mom from going from full-time to part-time, I did not have medical health insurance, but I did a lot of research on community clinics and with the referral of my friend and things that I can get, things that I would qualify for. It's important. It can be time-consuming, but it is important. So this particular exam was outsourced out. I did have to pay out of pocket, very minimal, but I wanted to get it done. So after the transvaginal ultrasound, it was now time for me and my doctor to discuss the results. And what do you know? So she and her assistant called me into the office. Again, she is amazing. Her assistant is amazing. She's a gynecologist. She's been a practicing gynecologist forever. And they wanted to have a discussion with me about what was going on with my body. Well, I had fibroids. I have a fibroid. And that was detected on that transvaginal ultrasound. And women who don't know what fibroids are, they are hell. And unfortunately, a lot of minority women experience this. And it's the worst thing ever. I know particularly in Black American women, Spanish women. Now, not to say that other, women, other nationalities may not experience or have fibroids, but it has been statistically proven that minority women suffer from this constantly. And it brings me to Fighting for Fertility, episode 1, titled Unanswered Questions. I have a lot of unanswered questions about why do we minority women, why do we have these fibroids? Where do they come from? What caused them? And I can be honest with you, when you start doing your research, fibroids, pull that up. As soon as you type it in, FIB, Google it, fibroids, you're going to get your information. Now, I like to go to WebMD and Mayo Clinic is where I like to do my research. They seem pretty consistent. It's pretty credible for their resources. So, you can Google and you see so much and it becomes so overwhelming, and you want to be able to be getting the most accurate information that you can and the most credible sources that you can. So I like Mayo Clinic, and I like WebMD. So make sure when you're doing your research, you're getting information that is very accurate. And also, I would still, of course, discuss with your medical provider. So fibroids are these non-cancerous, they're not cysts, they're these non-cancerous things that are like balls that are on the uterus. And they can be at different places, different sizes. They can be in the lining of the uterus. I mean, they are a disaster. And I'm now just told that I have fibroids. And I'm thinking in the back of my mind, oh my goodness, what about my kid? Right? Do you know that there are so many women right now who don't even know that they have fibroids? Women right now are possibly suffering in silence with extremely difficult cycles. I remember I'm referring to cycles as menstrual cycles or periods. And they don't even realize that they are suffering. It is not normal, again, to have excessive blood loss. Doctors will ask you how many pads or sanitary napkins are you using per hour? How many tampons are you using per hour? How much blood would you say you're losing? You know, they ask you these certain questions because they know what should be pretty much consistent when it comes to a woman's cycle. Every woman's cycle may be different, of course. We have different days, we have different lengths, different amounts of blood loss, etc. That's understandable. But the basics of a menstrual cycle or cycle is not for women to be suffering in silence. It's not for us to be suffering during our cycles. Yes, you may have some cramps. Yes, you may feel like eating or a loss of appetite temporarily. But it shouldn't be that we're suffering. So, please, if any of those things that I've just most recently discussed appears to you or you can relate to, please go seek medical attention. Talk to your physician. Talk to your nurse. Look for community clinics in your city. Do some additional resources. It's out there. Women of the world, we have to know and understand and be knowledgeable about our bodies. I've learned so much, and I'm so happy to say that I'm glad I did. I'm glad that I took the time to do my own research, and I'm actually glad that I'm on this journey. So, I have fibroids, and my doctor just told me the only thing that's going to help me is major surgery. Oh my God. I've never had a surgery, minor or major. I can't even think about it. But this is the only thing that can help me continue my fight for fertility. So join me next week for episode 2. Fighting for Fertility. Make sure to subscribe. Catch the intro. It's very brief. I just want you to know who we are, what we do, and understand that we are going to be talking about a multitude of topics. We're going to have tons of discussion. I'm going to be having guests, people that we can talk to, people that we can relate to, people that can encourage us and continue to motivate us across the world. So over the course of the next few weeks, I'm specifically talking about my journey and my fight for fertility. And I'm so excited to share with you, with no shame, women of the world. And I can't wait for you all to join me next week on my podcast, Learning to Live for Change. Good night.